Hi, my name is Dr. Tish Ryan, and I'm Division Chief of Pediatric Emergency Medicine at the Johns Hopkins Children's Center and co-director of the Johns Hopkins Child Injury Prevention Network, which is a collaborative group of faculty, staff members, and students across various areas of Johns Hopkins Medicine and the Johns Hopkins Bloomberg School of Public Health. I'm excited to share with you some recent work from the Child Injury Prevention Network, which was presented at the 2026 Society for the Advancement of Violence and Injury Research annual conference. As a parent, I know that pets can be a truly wonderful part of a child's life, offering companionship and important social and emotional benefits. As a pediatric emergency physician, I also know that interactions with dogs can sometimes lead to injury, and dog bite injuries are a common and preventable reason children are treated in emergency departments. In this study, we examined emergency department visits for dog bites among children and adolescents through age 19 across Maryland using a statewide hospital database from the Maryland Health Services Cost Review Commission. The goal of the study was to understand who is most affected by dog bite injuries, when these injuries occur, and how these injuries are treated. During this period, Maryland emergency departments treated an average of about 1,800 children every year for dog bite injuries. Boys and children between the ages of 5 and 9 were more likely to be treated for dog bites than other children coming to the emergency department. Most children treated for dog bites were discharged home the same day, and hospital admission was rare. Still, many injuries required significant care, with nearly 1/3 of children needing sedation or anesthesia. Dog bite injuries occurred more often in urban areas, but children from rural counties were overrepresented compared with their overall emergency department use. We also found that injuries were most common during the summer months. Medical costs for dog bite visits rose over time, with typical charges increasing substantially since 2017. We were surprised to see that the use of rabies prevention treatment nearly doubled during the study period, and tetanus prevention also increased, suggesting growing clinical and public health concerns. Overall, dog bite injuries remain a preventable and ongoing source of harm for children in Maryland. These findings point to clear opportunities for targeted prevention, education, and community-based strategies to reduce dog bite injuries, especially for groups and seasons at highest risk. I'd like to thank my collaborators and my co-investigators at Johns Hopkins Children's Center and the Johns Hopkins Bloomberg School of Public Health, as well as the Johns Hopkins Urban Health Institute for their support of this study.